So thank you very much for inviting me to this conference. I'm very pleased to be able to present you a little bit about news on rare disease terminology and coding in Germany. You can see here that the logo now shows the Federal Institute for Drugs and Medical Devices. Just to give you an update, DIMD, which was the former Institute for Classifications Development, had been merged in the beginning of this year with the Federal Institute for Drugs and Medical Devices, and we're now situated in 2 cities in Germany. So it's the former office of DIMD is now the location Cologne of BfArM, and there is a second location in Bonn, and the overall institution now holds about 1,300 personnel, so it's quite a big institution right now. The unit that I'm presenting has been merged into the BfArM without any change. So you have probably, as you joined previous conferences of this kind, you have probably seen my colleagues like Ulrich Vogel presenting at previous ones. So the team and the persons are the same, just the name changed. So I'll go into 3 points in my talk today. I'll give you an update about the rare disease coding in Germany, then the status and next steps that we're planning, and I have a few other news on classifications and terminologies that I'd like to share with you. So I put these on one of the last slides as well. Unfortunately, I will have to leave the conference right after my talk. So if possible, or if necessary, I'm available for a few questions right after the talk, but then have to go to another meeting. So what is rare disease in routine coding in Germany right now? In Germany, as you might know, we are using the ICD-10 in a German modification. So the classification has been modified to fit the reimbursement needs of Germany. And as the WHO version of ICD-10, this only has about 350 rare diseases with a specific code, as you can see here in the slide. For example, the Marfan syndrome as having a separate ICD code. So these patients could be identified in the German health system so far. Unfortunately, most of the rare diseases are coded with unspecified codes like the Q87.8. This, for example, here in the lower square, you can see an index entries on this code, and it holds about 88 entries, and you can see that many of them are separate rare diseases. So Germany discussed how to make patients with rare diseases more visible in the German health system. And for this, a huge group of organizations and patient representative organizations got together, and they're working on the National Plan for Action for People with Rare Diseases. That's the NAMSE, it's called in Germany, and they developed a huge amount of recommendations and action items, and one of them, the number 19, unfortunately this is only available in German, pointed out that the coding of ICD-10 GM needs to have more specific coding with ORFA codes, and this needs to be done before the ICD-11 is introduced to Germany, because this, as with other countries, will take quite a while. So we started in 2 big projects to prepare an approach that would enable physicians at the time of coding to code the 2 code systems at once. So we developed a huge file, and you can see here different columns. In the first column, it's a unique identifier, the alpha ID, which identifies each text entry here, and that's where the name of this file comes from. It holds all entries of the alphabetical index of the ICD-10 GM, so it's I think about 90,000 entries now, so it's a full terminology on diseases. It is coded to ICD-10 German modification, so these are the columns 2, 3, and 4, where you can see the German modification codes. You might notice that some of them are 5 digits. These are the areas where we go away from the WHO coding and add more detail because it's necessary for the reimbursement system in Germany. This even happens for the asterisk codes, as you can see in the column 3 with the M1439. So they're very precise in Germany. In the lowest line, you can see a code with an exclamation mark, the C97. So these are specific codes that are introduced only in the German modification. These are additional codes to be used together with a primary code. In this example, for example, it's a cancer coding. So as you can see in this table here, there is one column called ORFA numbers, and the ORFA numbers are introduced from the Orphanet system, and we have looked at the disease names. So the last column, the entry of the name of the disease, we checked against the ICD-10 German modification, and we added the ORFA number from the Orphanet system. We discussed all the entries that we did where we were not sure about the coding with Orphanet team in Paris and entered them one by one. So here you can see statistics on what we have done over the year. As you can see, the project started already in 2014, and we had a first file in 2015, and we added slowly entries to our files. The blue bars shows entries to the file, and the red bars shows the entities. So actually the red ones are specific rare diseases, whereas the blue bar includes synonyms to these rare diseases as well. In 2021, we are now close to 5,000 entities, so almost all the rare diseases that are in the European recommended file for statistical comparison are included now. So where are we now, and what are the next steps with rare disease coding? Since 2020, the coding together of ICD-10 German modification and ORFA codes is mandatory now for centers of expertise. So all centers of expertise for rare diseases have to code their patients with both of these code systems. The ICD-10 will then be used for the reimbursement, of course, but the ORFA code need to be captured to present statistics to the Ministry of Health and to the insurance companies and so on how many patients are treated in these centers. Linked to these presentation of statistics is some financial benefit for the centers. So if they can prove that they have a significant number of patients and that they're really acting as a center of expertise, they get some financial benefit for this. I included here the link to the organization. It's an organization of the self-governing body of Germany that has made this decision. And in the decision, it's explained in more detail how this is implemented in Germany. In preparation as well, which was just published 2 weeks ago, is new legislation that would allow or ask all hospitals in Germany, so not only the centers of expertise, but all hospitals in Germany, to capture for each patient with a rare disease the ICD-10 German modification code together with the ORFA code coming from the file where I just presented an extract from to you. So if this comes into action, which probably would start 2022 onwards, then it will be possible for Germany to present full statistics on the number of rare disease patients that we have and to see where there is big need for public health action, for example, where the rare disease patients are, where there needs to be more enforcement of treatment and diagnostic settings. So finally then, sorry, public health measures can be really based on the statistics. As well, this data will then be given into or fed into the electronic health record. As you might have heard, there is a lot of legislation ongoing right now to introduce an electronic health record for all patients in a centralized way in Germany, where all kind of information would be captured. And as this data will be captured with routine coding, we would hope that this goes into the electronic health record. So from that, of course, all kinds of benefits for the patients can be implemented, like warnings to physicians if specific treatment is necessary, like further information on the rare disease that they're having being accessed through the ORFA code from ORFANet then, and so on. So BayPharm, of course, will continue now to maintain this file that we have developed through the project. It will be a routine development now by BayPharm. We will expand the content to cover all rare diseases that are possible to be coded, and it will be presented in this Alpha ID SE, which is seltene Erkrankung, which is rare diseases. We will provide it once a year. It's usually published around October, and software industry is picking up already the file and introducing it in their IT systems. So as I said in the beginning, I have a few other news on classifications and terminologies in Germany, which are quite exciting. As you might know, we're the WHO collaborating center for classification. So our main focus was on classifications, procedure classification as well, functioning and disability classifications. And we had worked some with LOINC and other terminologies. Now, through new legislation as well, BayPharm will start to be the National Release Center for SNOMED-CT for Germany, starting 1st of January next year. And this is very exciting to finally introduce SNOMED-CT to the German health system. So, of course, this will be a big activity that we will have to undergo in the next years to introduce SNOMED-CT, but as well to link it to the classifications and terminologies already in use, like the ICD-10 German modification or the ORFA codes and our procedure classification and so on. So we're still preparing the release center, but everything will be up and running hopefully in January. So next year we will engage in this work. As well, the same legislation is addressing the use of LOINC in Germany to enable further translation. We already have a part of LOINC translated, but there is more need of the use of LOINC for the electronic health record. So we would put more effort in this in the next coming years, and we will promote a standardized use of LOINC in Germany together with the other terminologies and classifications again. Last big news, which we're very excited about, is that we're taking over the hosting of ORFANet Germany from the medical hospital in Hanover, the university, which has done this for many years already and has established a very good network of expertise on rare diseases in Germany. And they will assist us and hand this work over to us. So from January 1st onwards, BayPharm will also be the ORFANet Germany contact point in Germany and for the other European countries. This will make BayPharm the so-called National Competence Center for Medical Terminologies, and I add classifications as well, which already is mentioned in this legislation that brings SNOMED-CT and LOINC to Germany. And so it will appear in the future as a name on the BayPharm website. So that's a few information on the news from Germany on what we do on rare disease classifications. We're very excited to share this information with you, to participate in the RD Code project together with Czech Republic, and very excited to look into the future with all the new things that are coming up for us.